Hi, I'm Kristen Whitney with the University of Maryland Medical Center. Pregnancy is an exciting time, but it can be a little scary with the pandemic of COVID-19. There are a lot of questions, and we have answers for them surrounding the COVID-19 vaccine and pregnancy. Here with us today is Dr. Sara Crimmins, Assistant Professor of Obstetrics, Gynecology and Reproductive Science at the University of Maryland School of Medicine, specializing in maternal and fetal medicine. Thanks for joining me today, Dr. Crimmins.
Thank you for having me.
And today, Dr. Crimmins will be answering some of our most common COVID-19 questions, COVID-19 and vaccine pregnancy questions that we have. So if you think of any questions while watching this, please feel free to leave them in the comments below or give this video a like to let us know you're watching. So starting off, Dr. Crimmins, are pregnant women at an increased risk for contracting or becoming severely ill from COVID-19?
Pregnant women are at an increased risk of becoming severely ill for COVID-19. We don't think that pregnant women have an increased risk of getting the virus, but we do know they have an increased risk of hospitalization and ICU stay. In one study, there was a 6-fold increased risk of hospitalization and also about a 6-fold risk of ICU stay. We've also found that there's increased risk of preterm delivery in those with severe COVID infection in pregnancy.
Is the COVID-19 vaccine safe for women interested in getting pregnant? And have the vaccines been tested on pregnant or breastfeeding people?
So to answer your second question first, the pregnant and lactating women were left out of the studies that were done on the COVID-19 vaccines so far. From what we know, we believe that the COVID-19 vaccinations are safe in both pregnancy and lactation. The mRNA viruses, which is produced by Moderna and Pfizer, are mRNAs. And as most people know by now, they need to be stored at extremely cold temperatures. And that's because the mRNA is really unstable. Thus, when it hits your body, the body's very, very quick to kind of break down those products and make those spike proteins to give you immunity. So we do not believe there's an increased risk of it crossing the placenta. And in lactation, we think that even if it got into the breast milk, the neonate or your baby would be very good at breaking down that virus, that mRNA in their stomach acid because of how unstable that mRNA particle is.
If someone who is pregnant was interested in receiving the vaccine, is there a time during their pregnancy that they should look to get vaccinated?
We've been telling people that when they make it available to you, you should look into vaccinating yourself. We do know that you're not supposed to get any other vaccines within 2 weeks of getting the COVID vaccines. So there are some vaccines in pregnancy we recommend. One of them is the whooping cough or the Tdap vaccine, and we recommend that around 28 weeks. So most people will say that they'd like to time their vaccine not to interfere with that well-established pregnancy vaccine. So either before that period or after that period. There is a little bit of question about early in the first trimester in vaccination because of the fact that there's a lot of immune markers going on in that time as the pregnancy is accepted into the body. So some people would prefer to defer their vaccine till after that early pregnancy window is over.
And do you as a whole recommend that patients get vaccinated, and are you yourself vaccinated?
So I always tell people it depends on their risk. I think that everybody has the ability to make their own decision about this since there's not randomized control trials of pregnant and lactating women. And it depends on what you do for a living, how much exposure you have to other people, and what's your risk of getting the virus as well as bringing the virus home to your family. So if you happen to work in your house all day and have the luxury of not living in a multi-generational house or anything like that, you might be able to defer the vaccine to postpartum or even when you're done lactating. However, if you have a job where you have to go to work and interact with people, or you live with people that have an increased risk of getting the virus or getting sick from the virus, then I recommend you do it because there's no compelling evidence to say that it's a bad idea. I myself am a lactating mom currently, and I was very quick to get vaccinated because I knew that I was at risk for the virus because I interact with people who have the virus and happen to be pretty sick when I interact with them.
Is the COVID-19 vaccine safe if you're breastfeeding? Which I think you might have just answered that question.
So the answer to this question is, once again, there's no randomized control trial of lactating women to say that this is safe. We think that the vaccine is safe for the same reasons we talked about pregnancy, that the mRNA is broken down very quickly and that the chance of it actually getting into your central circulation is pretty low. In addition, if the mRNA happened to get into your breast milk, your neonate has a lot of acid in their stomach, so they would break down the virus and not have any harm to them. So we think it's safe, but obviously, as we learn more, we'll know more.
For our final question, if I don't get vaccinated, what are the risks of contracting COVID-19 during pregnancy?
So if you choose not to be vaccinated, that is your choice. And as obstetricians and gynecologists, we fully support you in your choice. And that if your decision is to wait till postpartum or after you finish breastfeeding, that's totally up to you. And I think we'll fully support you in that. If you choose not to, you have to remember that you do have an increased risk of contracting the virus because of an increased risk of hospitalization, and that you need to be diligent about your mask use, your hand hygiene, and your social distancing. In addition, if you choose to be vaccinated, it doesn't change what you do about your mask use, your hand hygiene, or your social distancing, because we know that those things are proven time and time to be effective against prevention of getting the virus.
Great. Well, thank you so much today for joining me today, Dr. Crimmins. We really appreciate you answering our questions about COVID-19 and the pregnancy vaccine. If you would like to learn more, please visit ums.org/vaccine. That's umms.org/vaccine, or feel free to leave a comment below or send us a private message if you have any questions for Dr. Crimmins about pregnancy and the COVID-19 vaccine. Thank you so much for joining us today.